Hello, I'm Nurse Zach. I'll be the nurse tonight. So you've just gotten some medication orders from your doctor. So first off, you want to get some hand hygiene done. We'll be moving to the med room, where we're going to be verifying the orders for this drug on the MAR. We're also going to be confirming or verbalizing that there are no discrepancies related to this drug and the patient, and nothing's going to be going wrong moving forward. Once we've made sure that there's no discrepancies, we would go through the charts and confirm that this patient does not have any drug allergies or contraindications related to this drug. We would then move to compare the patient's name on the order sheet in the room to the MAR. So we're comparing that this patient in this room is this patient in the MAR. Once done, we would do our first out of 3 medication checks where we're comparing the label of the medication to the label in the MAR. This is so that we have the right drug, the right dose, we're going to be going to the right site for application, and it is the right time of day to administer this medication. After this first check, you would perform your med calculations to get the right dose for this patient, and then you would have a nurse follow as accountability to double check your med calculations and sign off. Once done, we would recap our needle that has our syringe full of the medication for the subcutaneous shot, and move to doing our second out of 3 drug comparisons or checks. So we would compare the label of the drug with the label on the MAR again. We're going to confirm again that this is the right drug, the right dose, we're going to the right site, and it's the right time of day for the drug. Once done, we make sure that none of the medications were open yet, not until we're in the patient's room and we're ready to go. So once that's ready, we would then move to the patient's room. We would give privacy by closing the curtains or shutting the door, performing hand hygiene. We would get 2 identifiers from the patient. Most common are name and birth date, and after that we would confirm that they do not have any drug allergies or contraindications for a drug or medication moving forward. We would talk out with the patient the rationale of why the doctor ordered this medication, possible adverse effects they may see while on this medication. We're going to answer any questions that they have, and then we're going to get a verbal consent from the patient again. We would then perform a focal physical assessment on the systems that are going to be affected by the medication, and also get a full set of vitals. Once the full set of vitals is complete, we will assess the swallowing ability of our patient, and once that's done, we could then move to doing our third and final check with the MAR to confirm by checking the label of the medication with the MAR that we have the right drug, the right dose size, we're going to be applying this drug to the right site, it's the right time, and on this third check, we're going to confirm that it's the right patient name. So once that's done, we would assess our patient's abdomen. We're looking for any lesions, trauma, inflammation, or bony prominences. Once that is complete, you would then find your site for the shot. Usually it is about 1 inch from the umbilicus. And once we found our site, we would get an antimicrobial wipe or like an alcohol wipe. Clean the site with little circular motion starting in the inside and then moving out. With your non-dominant hand, you would kind of pinch, not super hard, but kind of just stabilize the area. Take your needle, cap is off. You're going to inform the patient of a stick. While grasping, you're going to insert the needle at a 90-degree angle. Lightly release your grasp of the subcutaneous tissue, insert all of the drugs. And once that's in, you would remove the needle and your hand at the same time. Place a cotton ball over the site. Throw away after putting in the safety interventions on the syringe. Usually now they have a lock that'll pull down the needle. Put it in your sharps container. Lift up on the cotton ball. Make sure that we have no redness, no bleeding or reaction on the site. And then you would cover that site with a Band-Aid. So your subcutaneous shot is finished. Now we would then move forward. We're going to replace our gloves after removing the dirty ones, hand hygiene, put new gloves on. We would raise the patient's head of the bed to now 30 degrees, almost having them sitting upright so they could take this medication correctly. We would place all of the oral medications in a container like a cup or a spoon, administer that to the patient, verbalize them to take all of their drugs that they're needed to, and once that is done, we would then put the bed in a comfortable position, lower it, lock the bed, raise the side rails up if they were lowered, give the patient their call light, perform hand hygiene again, and thank them for their time.